Key senator requests details on a recent data breach. A House committee investigates Affordable Care Act marketplace fraud allegations. And several notable personnel changes are announced at the U.S. Department of Health and Human Services. For the week of February 16th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Opposite. So tell the truth about Obamacare. It didn't work. We all know it didn't work. And now we're going to give an enhanced subsidy, continue that to insurance companies. So I'm totally against that. But what I said was, if we do real reform that increases choice and competition.
Kicking this week's episode off with news from Capitol Hill, where House Judiciary Committee Chairman Jim Jordan, a Republican from Ohio, and panel Republicans are subpoenaing health insurers participating in the Affordable Care Act marketplace, citing allegations of fraudulent use of federal subsidies. The 8 insurers subpoenaed include Blue Shield of California, Centene Corporation, CVS Health, Elevance Health, GuideWell, Healthcare Service Corporation, Kaiser Permanente, and Oscar Health. The lawmakers reference a recent Government Accountability Office report which found billions of dollars in unreconciled Affordable Care Act subsidies per year, and examples of tens of thousands of Social Security numbers subject to potential fraud. The subpoenas demand details about each company's fraud protection measures, requesting a response no later than February 23rd. Senator Jim Banks, a Republican from Indiana, has written to Dr. Marty McCary, the Commissioner of Food and Drugs, urging the agency to take enforcement against compounded weight loss medications that are being marketed by telehealth and online pharmacy platforms. Senator Banks suggests the agency consider the feasibility of requiring more explicit warnings on those websites in violation of federal drug law. He also asks the commissioner to expound on a recent statement that the Food and Drug Administration would work to limit the active ingredients used to make, quote, non-FDA approved compounded drugs that are being mass marketed by companies as similar alternatives to FDA approved drugs, unquote. The letter follows Banks's introduction of the Safeguarding Americans from Fraudulent and Experimental or Safe Drugs Act, which would impose new restrictions on compounding pharmacies to prevent the mass marketing of non-FDA approved drugs.
Hit by ransomware and phishing attacks. In the health industry, patient care is time sensitive. As a doctor, I cannot express enough the importance of timeliness in care. Cyber attacks that delay care cost American lives, and that was
the voice of Senate Health, Education, Labor, and Pensions, or HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana, who's investigating a recent data exposure that took place within the Illinois Department of Human Services. Senator Cassidy's letter to Governor J.B. Pritzker, Democrat of Illinois, requests detailed records from the exposure. The letter reads, quote, protecting the privacy and security of sensitive health information is essential to ensure that patients receive the best care and that their information is not misused. Cassidy goes on to say, quote, despite IDHS's role in helping vulnerable communities, its repeated failures to implement basic security processes highlight IDHS's disregard of its responsibility to over 4.6 million Illinois residents, unquote.
Absolutely. So in the past few decades, as we all know, we've seen a big rise in so many chronic diseases. And the solution is not just keep building hospitals and hope that things change. The solution is doing better science, leading into better advice. And
final news today, where several notable personnel changes were announced at the U.S. Department of Health and Human Services last week. HHS Deputy Secretary Jim O'Neill and General Counsel Mike Stewart will not remain in their current positions, but are reportedly being offered other jobs within the administration. Armand Sharma has been hired as the Deputy Chief Artificial Intelligence Officer. Sharma is a recent Stanford University graduate. During his time in school, he co-authored a book on the economics of medicine with current National Institutes of Health Director Jay Bhattacharya. Director of the Center for Medicare, Chris Klomp, is the new chief counselor at HHS and in charge of overseeing all department operations. He'll retain his current role as well as reporting to Secretary Robert F. Kennedy Jr. HHS Chief of Staff Matt Buckham will become Senior Counselor for Operations and Personnel, and HHS Chief Policy Advisor Ken Callahan will become Senior Counselor for Policy. Both will report to Klomp. At the Food and Drug Administration, Deputy Commissioner for Human Foods Kyle DeMontis and Deputy Commissioner for Policy, Legislation, and International Affairs Grace Graham have been appointed senior counselors. They will also remain in their current roles. Finally, Centers for Medicare and Medicaid Services Chief Policy and Regulatory Officer John Brooks will also serve as senior counselor while remaining in his current role.
Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.